My name is Jeremy Edwards with GAINSWave, and I'm here today with Dr. Ian Levenson, GAINSWave provider in Colorado. Dr. Levenson, thank you for being with us today. And if you can start off by kindly telling us about your specialty and your practice.
Yes, thank you very much for having me. I'm board certified and trained as a family physician, and I also am trained as a lipidologist, which is a heart attack prevention specialist. I got involved in regenerative medicine through GAINSWave and also through platelet-rich plasma, of which we have a sophisticated lab here to concentrate and to augment the aspects of GAINSWave therapy and regenerative medicine.
Thank you, Doctor. And on the topic of GAINSWave, how did you hear about GAINSWave originally, and how long has it been part of your practice?
I went to Aventura, Florida, and I've spent more than once there. I've been there 2 or 3 times, training with the people at GAINSWave, and I've had it in my practice for about 3.5 years.
Thank you. And what features of the GAINSWave membership in particular do you find most valuable, whether it's the sales and marketing, business support, patient referrals? What exactly, Doctor?
I think it's a combination of things. One, it's very educational. So I find their website is constantly being updated, and they have multiple videos on the procedure with different equipment, cleaning procedures, marketing issues. So as things change or equipment changes or the protocols become improved, you're very up to date on that. And also in the beginning, when you're beginning to work with the procedure, you have the ability to go back and review the procedures and the settings. And so it's really very helpful. And it's been very beneficial from that standpoint, and also from a marketing standpoint. You get leads from them. They have courses on how to market. I just think that, and they also have equipment that you can purchase for your patients on that as supplemental, such as penile pumps and a Firm, which is a nitrous oxide agent that is very effective in augmenting your therapy.
Thank you. And on the subject of patients, how have your patients responded to GAINSWave treatments?
The response has been excellent. You know, I think the response is somewhat related to the evaluation of the patient and expectations. So one of the things that I think GAINSWave does well, and I think that you have to emphasize, is that your outcomes have to be realistic. So evaluating the patient to know what's going to work best for them is going to be a key factor to your outcomes. So if you have somebody who has had prostate surgery and is diabetic, they're going to need a different protocol than somebody who's 35 and wants performance enhancement. So I think the evaluation is crucial, and the outcomes of that will be proportionate. So in most of the outcomes on a SHIM score, I get a 5-point difference from when they started at the end of 6 treatments.
A 5-point difference, that's quite considerable in many of these cases. Is there a specific GAINSWave patient story that stands out to you?
Yes, I would say the most rewarding is a gentleman who is 72. He had prostate cancer about 10 years ago. His wife then got sick and died. And so he was not really interested in his sexuality for probably about 7 years. When he came to meet somebody is when I first saw him, and his scores were very, very low. We used a combination of GAINSWave with P shots or PRP injections in this particular individual, and from having a function of not being able to have sexual intercourse or intimacy with somebody, he has very good sexual function and can perform pretty much on will when he needs to, and can have a meaningful relationship, and now is getting married to the woman that he was dating.
That's an incredible story. Thank you for sharing that with us. And what would you tell a fellow doctor who's considering adding GAINSWave to their practice?
I would highly encourage them to do that. It's very beneficial. There are very few complications that you can get involved in. The equipment you need to have in order to create the availability in your office is not really capital intensive, and the ability for someone to have an intimate relationship is very significant. Men bond through physical contact, and so the intimacy of having sexual intercourse is very important to them, to bond and feel closer to the person they're with. So having the ability to do that in a relationship is pretty central, and I think it's a very important aspect of that relationship. If you can have somebody resume to being able to do that, it's extremely rewarding.
Dr. Levenson, thank you very much for your support.
Take care. Thank you.